This is the Equity Charter podcast, where we talk about why we care about equity in the digital health sector and why we think you should too. Welcome to this week's episode of the Equity Charter podcast. My name is Aisha Rahim and I'm a psychiatrist and Chief Clinical Information Officer working in the NHS. Along with my colleagues Hassan Chowdhury and Victoria Betton, we developed 10 principles for embedding equity within the digital health sector. This week, we're deviating from our normal schedule to bring you a bonus episode of the podcast. At the end of March 2026, the Equity Charter attended the Digital Health Rewired conference, where we hosted a panel of 3 special guests who told us how they embed equity in their organisations. We hope you enjoy it.
Hello everyone, my name is Victoria Betton. I'm co-founder of the Equity Charter and we're delighted to be here at Rewired, both exhibiting, we've had a panel session and now we have our podcast session with a really great panel and we'll be having a chat over the next 45 minutes or so. So before I invite my guests to introduce themselves, I just want to remind people or let people know, if you haven't heard about the Equity Charter before, what we're all about. So we're a campaign for greater fairness and equity within the digital health sector. We're co-founders, myself, Aisha Rahim, who's a doctor in the NHS, and Hassan Chowdhury, who has lots of different roles in the private sector connected to digital health. It's actually our 2-year anniversary today, so we're really especially delighted to be here for that reason. The Equity Charter is a set of 10 principles that we developed with colleagues in the community. And really, ultimately, what we're about is narrowing the health inequality gap. Our principles cover things like individuals taking responsibility for promoting equity through to leadership, workforce, design and development of digital products, data, procurement, and so on. So, there's something in there for everyone who's working in our sector. And we have a community of practice run by Gurnak and Emily. And we've also launched our own podcast today. You can find all of these things on our website, equitycharter.digital. We have a LinkedIn page and you can find our podcast on Spotify and so on and so forth. And earlier today, in our panel session at Rewired, Aisha, who was chairing the panel, announced our partnership with Virgin Media, O2 Business, which we're really delighted about and we'll hear a bit more about today. So, without any further ado, I would like to invite my 3 guests to begin by introducing themselves. And Martin, I'm going to hand over to you.
Perfect. Thank you very much. My name is Martin McFadyen. I'm the Director of Public Sector at Virgin Media O2 Business, which means I have responsibility for our relationships with all of our public sector customers, the length and breadth of the country, everything from central government all the way through every other segment of public service. And also really strongly backing the partnership that we've announced today with Health Equity Charter. So thank you very much.
Thank you, Martin. And Joe, over to you.
Hi, my name's Joe Waller, and I'm the founder director of a company called Aire Logic and also a product company called Aire Innovate. Aire Logic is a software implementation company, consultancy. And we build many of the national NHS systems as well as lots of local NHS systems and now also in education and other tech for good sectors as well.
Thank you. Lovely to have you with us, Joe. And Annie.
Hi, I'm Annie Chamberlain, Head of Service Design and Experience in the Digital Service at Somerset Foundation Trust. So we're a team of service designers, user researchers and business analysts. And I think the easiest way to explain what we do is that we're the people of digital transformation. So we really focus on impacts on people and processes rather than the kind of technical side of digital transformation.
I love the fact that you're the people's people. Good strapline. So Annie, maybe I'll just come to you to build on your introduction. And maybe you could say a little bit about why equity is important to you and your team and your organisation.
Yeah, and this is something the team are really passionate about. And I think because healthcare is getting increasingly digital, equity is really important because if we get it right, we can really use technology as a powerful tool to help us reduce inequalities. But if we get it wrong, there's such a large risk that we can increase some of those existing inequalities. So that really matters to our patients, because often the people that we exclude or we disadvantage through digital transformation are the people that need the healthcare services the most. And it also importantly matters to our colleagues, because they're under pressure, they're working in fast-paced environments, and we're giving them a lot of digital change and transformation. There's a lot going on for them, and that can be really difficult. So we really need to understand the diversity of our workforce and their needs and how digital can really work for them, and really try to build the system so that we support those colleagues and that it just works for them, rather than them having to change their behaviour around the technology.
So it makes good practical sense. There's the moral case, there's the ethical case, and then there's that actually it's just a good way of running a service, running a team, meeting the needs of end users. Definitely. Joe.
Thanks, Victoria. So in a similar way to Annie, really, we've seen the industry change over the last 10 years massively. A lot of the national and the other systems that we build, equity has become a really important part of the process for all the good reasons that we've started to talk about. You definitely sort of design for diversity now, and something that the NHS as a customer expects from us, and all of the efforts that go to really assess a pathway are much more equity focused than they ever used to be. We also have to assess the offline pathway as well as the online pathway to ensure that we're supporting the stages outside of the digital journey as well. So it's just become a big part of what we do for our customers. In addition to that, though, the second facet for us as Aire Logic, because we're an employee-owned and a low hierarchy company, issues and discussions about power is an important part of what we think about in the workplace. We're low hierarchy, and so privilege and power is also a big facet, a big factor in equity as well. So, equity naturally becomes part of our daily discussions in the workplace as being that kind of a company.
So really you're designing in equity consciously into how your organisation operates and works day to day.
Yeah, exactly. I think, it does start with those power dynamics, and it starts from the very top, which is a thing that we try to de-emphasise anyway. And I think it's not that equity and equity measures can't work in more traditional organisations. They absolutely can. But for us, it's very much the heart of what we do anyway. It's very natural, I think.
Thank you, Joe. And Martin.
Yeah, thanks, Victoria. And I guess from a Virgin Media O2 business point of view, we take a look at the whole marketplace and the opportunities and challenges that our customers face into, and start from that position. And we know that there is increasing demands upon the NHS. We know that patient waiting times are not quite at the levels where anyone would want them to be. And we know there's a desire to do more care in a virtual setting or care closer to home for that. And a lot of this is enabled through digital, but there's an expectation on everybody being digitally capable and digitally confident. And we understand, as a technology company providing what we do, that's not always the case. So therefore, when we're talking to our customers around any services, solutions that they are taking from us, we are equally wanting to understand how we are making that better for the citizens, the patients that they are serving and looking after. Because we know from broader work and studies that we've done that 1 in 4 adults across the United Kingdom are currently digitally excluded. And that statistic increases when we look at areas of deprivation and underserved communities. So therefore, if you've not got the equitable access for all as a kind of baked-in seam of the services you're delivering, you're inevitably going to leave people behind, and you'll become a them and us elements of society. And that just makes the situation worse. So if we really want to deliver the full value for every pound of public money that is being spent, we want to make sure we get the best possible return on that. And that's about making sure that we take all of society on that journey and that development, recognising that not everyone has the skills, not everyone has the access, not everyone has the confidence. And how do we make sure that that is a big part of all of the services, solutions, contracts, procurements that we're involved in with our customers?
And just to build on that and also bring Joe back in. Joe, you talked about your NHS customers demanding that you take diversity into account. For a listener who maybe isn't convinced about equity, but maybe is interested in the business case, what's the business case? And I think you started to touch on that, Martin. What do you see as the business case, thinking about procurement, thinking about contracting, thinking about how you position yourselves in the market? Why is this important So you start, Martin, and then Joe, you come in.
Yeah, and it's all too easy to put the business case down on it's going to cost us X number of pounds to buy this thing, and the return on that investment's going to be Y over a set period of time. But that's often quite hard to really quantify what that is. And typically when we see that within public service organisations, a lot of it is around we want a better service that does more for us, but we want it for a cheaper price. And that's because of the budget challenges and constraints that we fully understand that the public service are operating within. But there's a better way to be able to reduce the cost burden on the public purse, and that's about making sure that you address those underserved segments of society to make sure that they are able to have better access, more equitable access, and then that reduces the demands that any of those individuals are putting on the service, which then in turn delivers a better return for the overall business case. But I fully acknowledge that that's really hard to quantify, and it's one that lots of people much smarter than me scratch their heads on, and how do you turn that into pounds and pence on a spreadsheet, and you want to do the assessment of it. And equally, we've talked with regional authorities around, is there a wider regional economic benefit? So the extreme example that I'll give you is a healthcare organisation saying that they can deliver virtual appointments and virtual care, which then reduces the need for people to travel, increases appointment time, reduces cancelled appointments, all of which again have a cost on the NHS. But by doing those virtual appointments, what we're also doing is reducing the traffic on the road. So you then reduce the traffic on your road, then you're reducing the CO2 emissions from that traffic that's on your road. You're reducing the wear and tear on your roads, and therefore the council has a benefit of not having to repair the road surfaces as much as they previously did, which then has knock-on impact into CO2 contributions as we all think about net zero as another equally important factor, and think about that as the whole system. And I refer to it as UK PMC. And how do we make sure that we're thinking about that on a regional and economic impact? You could take it a stage further and say reduced CO2 emissions into the environment then also means that respiratory issues reduce, then less people are coming into hospital with those. There's also stats that prove that children who have clean air are much more able to concentrate at school, therefore their education is better, then their life chances are better. And so it's a knock-on positive impact. And I think that's my, if I was to have a dream, that would be my dream, that we'd be able to get there to that point and have the utopian view that we can think of it in that way. But I fully acknowledge that we're not there yet.
But we're talking about it, right? And what you're talking about is like a circular benefit that keeps on sort of compounding itself in a positive way. But we need the system to think like a system.
Absolutely.
Rather than a series of silos. So, Joe, I'd like you to come in and maybe you could touch on social value as well, because I think that's often in businesses' minds when it comes to public sector procurement.
I think earlier on in the panel session I mentioned this as well. Social value has increasingly become an important part of procurement, of course. It's now 10% of any of the procurements that we are involved in, and we were really happy to see that being the case. And I think at the time, many companies, for us, we felt it was going to be a good thing because we were already very involved in that. Some companies, maybe it was more of a burden. But in fact, I think the kind of attention that it's forced all of companies to pay to social value has been a really positive thing. It's become more than lip service. I think lip service itself is a good thing insofar as it can lead you on to a more authentic engagement with equity issues. And I think that's what the mandating of the social value elements of procurement has really done for the UK.
And you've invested in a social value role in your organisation, right?
Yeah, we've got a dedicated social value officer and also an assigned EDI officer as well from the HR team, and definitely seen that improve our output, both for selfishly for ourselves in terms of the quality of their social value tenders and authentically for the people, the outreach that we do and the people we work with, the patients we work with. It's made a big difference there too. A lot of it's been about matching up the work that we instinctively did with the complex categories that are part of the social value sort of procurement assessment.
Thank you, Joe. Listen, I'd like to move on now to letting the listener hear some really good examples of great work that you're doing, and it was fascinating to hear it in the panel earlier. So, Annie, I'd like to come to you, and I know as a team you're doing some really interesting, innovative stuff in your team. So please, could you share it with us?
Absolutely, yeah. So I work with a lot of people who are implementing projects and change in the digital space. And I think it's fair to say that most of those people really want to do digital inclusion and equity well, but they're busy and not everybody's an expert. And I think sometimes people are afraid that they might get it wrong. So what we really want to do is try to focus really on how we can change the system and make it much easier for people to build equity into decision making and processes much more easily. We know people are under pressure, and we know projects are often constrained by time and budget and resource. People don't always have the opportunity to go out there and talk to lots of people and really understand these impacts. So we're focusing on how we can make that easier. Our digital inclusion lead in the trust, Harriet, said recently, we really need to change the system, not the people. And I really like that, because I think actually we need to just think how can we make this better and easier for people to do it well, and just do it as part of our day-to-day by design, not as something that's kind of an added extra or seen as a bit of a burden or a governance process that they just have to do. So there's a number of things that we've been trying to do. One of those is we've just made digital inclusion a team priority. So that means that we have digital inclusion on our team agendas every week. It means that we are regularly talking about it. We're talking about what works, what doesn't work, sharing any learning, which I think has been really helpful for everybody, because we're still learning as a team around this as well. And as part of those team meetings, we have a accessibility tip of the week that we post on our digital wide team site. And this is just a really short tip to help people think about how they can build accessibility into their day more. So just a few recent examples. One's around how you could use some of the functionality that are built into the things we use every day, like Microsoft Word, that can help you, for example, reduce the reading age of your communication so it's more accessible to more people. We also use those tips to signpost people to really good guidance or frameworks, things like the Equity Charter, of course. And we discuss topics. Acronyms is something that we talked about recently, which generate an awful lot of discussion, because I think anyone that works in the trust knows that actually there can be multiple meanings for the same acronym. So that can be something that's quite difficult. Certainly when people join the trust, I think I can relate. It feels a bit like learning a new language as it is. So that was a good one. And actually, I think that just that really small action of adding an accessibility tip of the week onto a platform has really helped change the culture within our service. People are talking about inclusion more. Recently, people have started from wider teams posting their own accessibility tip of the week. So it's really nice to see people talking about it and wanting to do more of that. Another really exciting piece of work that we've just started is around our equality impact assessments. So that is something that's going to impact everybody trust-wide. Those impact assessments are designed to help people implementing digital change or projects or new systems or services to think through the impact of that change on groups of people, particularly the underserved community. But what we found in a recent discovery piece of work is that actually our equality impact assessments across the trust really vary. We're very inconsistent about when we do it, when we don't do it. We're not really clear on when we should or shouldn't do them, where the forms are, which form to use, what the process is to follow. And when people do equality impact assessment, we find that they really vary in quality. I think that's often, it depends on the author. So their own knowledge, their own expertise, also their own abilities in finding relevant research and analysing data. Not everybody involved in change is an expert in those things. We've also found that they're often done too late in the process. They're not done at that decision point. And they can be seen as a bit of a tick box exercise rather than something that's genuinely shaping decisions and positive outcomes for people. So there was a bit of discussion about the fact that we need to redesign the impact assessment form. But thankfully, a group of really good people came together and we decided it's not really about the form. It's about the practice and how we can help our colleagues do better quality impact assessments that are evidence-based. So we're coming up with a tool at the moment, making use of technology that we already have. So it's not about buying something new. We're using AI and some of our other technology to try and help us to build a few things, really. One will be a database of population data, trusted guidance, good practice, examples, frameworks, all the information that's out there about what's available in the community to help people, and try and have that kind of all in one place. And then an AI platform where anybody in the trust can put a little bit of detail in about their project or their change, and the AI can then search that database and hopefully come back with a really good first draft of an impact assessment and help those people to really think through who their change is impacting and what they can do about that. We're really excited about it. Microsoft have just created a very early iteration of that, which we're starting to test. And in the next couple of weeks, we're planning to hold a hackathon, get a few people in the room who are involved in equality impact assessments and end users as well, to work on that and build hopefully a product that works really well for us, and hopefully something we can scale and continue to develop. Other things which I'll touch on, we're also doing more work around personas. So for anyone that doesn't know what a persona is, it's a kind of profile of a fictional character, but it's based on the real insights that have been collected by our user researchers and our business analysts from real people in our local community or our patients and our colleagues. So we might produce a persona that talks about somebody with low digital confidence, limited income, unstable housing, and use that to test if our digital solution would work for them. And I think that's really helping us think about how changes impact people in the real world, rather than just a kind of abstract report and data. And finally, we've been working with our procurement team to look at how we can train some of our leads and give them some guidance on how to build equity into procurement exercises. And also just putting together essential criteria for accessibility and user needs and inclusion. Many of the systems that we use at the moment don't even meet accessibility information standards. So that's something we really need to change, and we want to change. And I think it's really important because we don't have design control over all of our technology. We buy a lot of third-party systems, but we're still responsible for making sure that they're inclusive and they're accessible and they're usable, and we need to be holding our providers for account for that. So we really want to help colleagues to be able to do that well.
I just love, Annie, how you're just doing really tactical things that make a difference. And just by making small changes, you're elevating the importance of things like inclusion and equity. So scheduling in the accessibility tip of the week, putting inclusion on your agenda are just really small practical things, but they mean that it's constantly on your team's mind. And I'm a big fan of frugal innovation. So taking what you already have in terms of the products you have and using them in a creative way to improve equality impact assessments, which I've rarely seen a good one done, it's just amazing. So I'm hoping our listeners will take away some really good tips there, then. So Jo, I know you think about this a lot in your organisation, and you have some really good infrastructure as well. So talk us through some of the things that you're focusing on to make a difference when it comes to equity at Aire Logic.
Well, clearly you touched on some of the small things. I think small things do make a difference, and come back to them. But obviously we're doing some of the key important things as well around assessing our pay gaps for gender and ethnicity, and then trying to work to improve the portion of women. I think we're about pretty average for the IT industry in terms of the number of women working in the company. From a leadership position point of view, we do fairly well at the senior management level. We've got female directors, so that's less good, albeit one ethnic minority there. So we are looking at those portions, of course. From a recruitment side, that's a really important element. So we've got a lot of focus on the recruitment side. We're particularly keenly on recruiting female engineers, because of all the job roles within the IT industry, the engineering area is the area which is particularly difficult for women. So as well as doing the outreach to schools where we try and promote IT for women and for people with less privileged backgrounds, we're also doing a lot of recruitment drive to get young female programmers. And interestingly, our pay gap has obviously varied over the last few years. It's always been better than the IT industry standard, but it's got a little bit better. It went down to 7% last year, and then this year was back up to 9%. And when we did some of the analysis, and I think that's an important thing to think about too, getting underneath the numbers, so things like the pay gap analysis is really important. When we did the analysis, we realised that we'd employed a lot of senior engineers. And frankly, it's really hard to find female senior engineers. So when we looked at the detail, we were actually paying our junior female engineers better. Our female staff in general get better bonuses, it turns out, not by design. But the pay gap had got worse because we needed a real drive on senior engineers, and it's so hard to find those female senior engineers. So there's a lot of focus for us around the improvements.
And in terms of that greater diversity in terms of gender, what's that doing for your organisation? What's the benefit to Aire Logic and to the products and services that you deliver?
I mean, it's a cliche, but I think it's still true to say that diversity brings creativity. And there's another element to this as well. There's another selfish element, which is that I think the world is really changing. I think, frankly and bluntly, in the more educated facets of society, there's more so than in other parts of society, there's a real expectation around equity. And if you can become an organisation where equity is natural and part of the DNA, you do attract better colleagues. And so it's a virtuous circle. It's not primarily for selfish reasons, but it actually is a virtuous circle, particularly in the tech industry. If you want to get great people, they've got expectations about equity from the start, really.
Oh, fantastic. So it's about being a good employer as well, producing good people. Martin.
Thanks, Victoria. And I spoke at the recent Women in Tech and Public Sector event that we hosted at Virgin Media O2 in our office, which was a fantastic event. And similarly to what Annie and Joe have said, one of the comments that I made was, there's no big grand gesture or thing to do around. It's lots of little things done consistently every single day. And that's got to be just baked into the fabric of every individual and every organisation to make sure that it's just how we operate, how we work, how we show up, because it's what we should do. We want to be ensuring that we are truly representative of the UK society, and that has changed. But I think in tech particularly, we've still got a bit of a way to go. And we talked about some of the stats in respect of, as Joe's just mentioned, women's underrepresentation within the tech community. And we've got a bit of work to do on that. Within our organisation, we have done some of the similar activities that have already been mentioned, including running any job descriptions and job adverts through our recruitment team with a specific tool that they've got, and I forget the name of it, apologies, where it assesses the language that's on the job description and in the job advert to be able to make sure that it's gender neutral, which I didn't even know was a thing, if I'm being perfectly honest. But it's brilliant to ensure that we are getting it right from the start, and then that experience follows all the way through. So equally, we make sure that as we are recruiting and interviewing and onboarding, there is a balance in any interview panels and selection process, so that there's no bias in that process in any way. And then make sure that as we onboard people into the organisation, they're fully aware of all of the available support that exists. So we've got a number of inclusion network groups across the organisation, covering many, many different aspects. So neurodiversity being one of them, gender diversity is another one. And it's living and breathing, as I say, just every single day, and showing up intentionally to demonstrate that this isn't just lip service. This is how we do business and what we do. And then coming to our customers is then making sure that we are demonstrating that in the conversations that we're having with our customers as well, to, in some cases, in a friendly way, challenge their thinking and their approach to make sure that there is consideration on the outcomes that they're trying to achieve with any procurements that they're going to run, and have they truly considered the inclusion of everybody that they need to consider? Do the staff have the capability to utilise the technology that's being deployed? Or are there going to be staff members who become alienated and left behind as part of it? And then in the public service domain, are there members of society who are going to be excluded or left behind on that, and then further create a wider gap on that one? So it's by getting it right from the start in respect of writing the job articles, doing the interview process, onboarding people to the organisation, doing the consistent things every single day, and then showing up to our customers in that same consistent manner and having the conversations that are open and honest. Can be challenging at times, but done with the right intent, then I think we all get the best outcome for all of it. Yeah, I think that's probably the headlines for me.
Thank you, Martin. And, Joe, you talked about power, and power absolutely is at the root of this. There's also something I'm picking up around curiosity and empathy that's really important in this, and seeking to understand what life is like for people from lots of different backgrounds and experiences, and using that to be inclusive. But Aisha, Hassan and I are really clear that we are not EDI experts. We're learning ourselves. We don't always get things right. And we're very keen to start where people are at and amplify the good things that are happening. But we also learn a lot by learning from the things that go wrong and don't work so well. So maybe, Annie, you could share a few things with us that maybe are top tips, or things that people might want to consider to avoid getting things wrong.
Yeah, I think in terms of kind of top tips and advice from what we've learned, as I think we've all said today, we're not experts. We're constantly learning. It's a bit of a journey. And I think it's just better to do a little bit better than to not do anything at all. So do the small things. They're not too small. And it's those things that contribute to change over time. And also, I think some advice from our team would be that it doesn't have to be in your job role to fix this and to do something about it. The problems that we've identified around the equality impact assessments, I don't think there's an owner of that in our trust. I'm not sure why we've not fixed it before, but I think we just all expect it to be somebody else's job role to do that. So I hope really this inspires others to take action, even if it's not in your job description. You can do something about it and you can champion equity. I think some of the other kind of challenges that we've seen and lessons we've learned are around building understanding, really, and some common understanding around some of the terms that we use. We found ourselves trip up a little bit with understanding what we mean by things like user-centered design, inclusion, diversity, even words like underserved communities, digital literacy, digital maturity, change readiness. Like, we use all of these terms, but people don't really always understand what they mean. And I think if we're not clear which problem we're addressing, we might not be doing the right thing. A good example of that recently for us was where we were hearing about digital literacy kind of being used as a catch-all for our staff's ability to use a digital solution well and for them to adopt it and to optimize it. But it's more than that. I think it's about accessibility and usability and confidence and motivation and their environment. And we need to take all of those things into account if we want staff to be able to adopt and use the system well. I also heard somebody say recently, we're covering inclusion because people that don't want to use digital can still use face-to-face or telephone. And I think while that's true and that's really important, there are also people that do want to use digital. So if we don't remove those barriers, we're still stopping them and we're still disadvantaging them. So we need to actively do that. So lots of learning, lots of things we haven't got right yet, but I think that's okay as we're making progress and we're just trying to do little things.
And take action rather than expecting someone else to do it. So I love that. Jen?
Well, let me first touch upon something Annie said, because I think it's really important on the sort of major services that we developed at the NHS. I used the term earlier on, designing for diversity is something that's expected. And so, not making the assumption that someone who's less digitally able, can merely use the older routes. Some years ago, I would even say, if we catch 80%, 90% of patients through the digital routes, we're saving money, we're saving time for those, we're creating capacity for those less digitally savvy people. And that was okay. It's still a useful thing. But I think the expectation now is much higher. And a lot of the work we're doing is thoroughly assessing the patient pathway, the offline elements of that, finding where the friction is, introducing physical elements, even digital training, to ensure that the less digitally able can really engage with digital services. And it's, Martin touched on it earlier on, it pays back because, we're also measured on uptake on these national services. And the more we do that, the more we get uptake. And once people are used to the services, they'll stick with it. You only have to train them a couple of times and they've got it. So it's a short-term investment for a longer-term savings at NHS.
And is there anything you'd like to say around like top tips or lessons that you've learned at Logic, Aire Innovate over the last few years?
Yeah, I should mention the Equity Charter Diagnostic, which was a fascinating experience for us. I think as a low hierarchy company, particularly, there are some outputs for us that may or may not be so relevant to others, but they were hopefully interesting nonetheless. Specifically, the sort of most senior leadership in the organisation, including myself, tend to step away from many activities. I'll let the organisation do its own thing. We give time and space for people to do their own thing. And we often don't even know what's going on. It's common that I don't know. And then I hear about something, and that's, something in the ECTA space that sounds brilliant. So, but as a result, we'd stepped away from the EDI committee. Again, let it run itself. But actually, we had to accept that even in a low hierarchy organisation, leadership's still important. And it was a clear message from the assessment that we needed the directors to get a little bit more involved in that committee, which we've since done. And it has made a real difference to attendance. I think the attendance and the attention, unfortunately, in a way, has improved from the attention of those senior leadership.
The Equity Charter Diagnostic is a workshop that we run with digital teams, either in industry or in the NHS, helping teams think about the 10 principles and where they are in relation to them and how they might take steps to improve. And Joe, your team was just brilliant to work with. They were so enthusiastic and they totally grabbed it and ran with it. So it was a joy to work with them. Martin, top tips. What have you learned that you would like to share with our listeners?
I think the top tip for me, and I'm going to phrase this slightly differently than I did earlier on, as being the annoying child, I think I said earlier, is channel our inner child. I think we, all too often, and Anne kind of touched on it, we have a tendency to think that we should know everything, or certainly know more than we perhaps give ourselves credit for knowing. And therefore, we walk into rooms with an assumption that we've got the answers. And I think we should be more open to always being curious. To your point earlier on about let's always be open to learning. And you only achieve that openness to learning by being curious about what is it we're doing, why are we doing it, what we're trying to achieve by it, and how do we get the best results from being able to do that. And the byproduct of being able to walk in and have a conversation of that kind of nature is it equally creates an environment of psychological safety. And that in turn then means that you have a much more honest, open conversation. Nobody's on edge. Nobody's thinking that they're going to be tested or judged based on what they do or don't know, what they say. And then you can build a much better relationship, build a much better partnership, and deliver a much better outcome. So my kind of top tip is just always be curious and don't worry about not having all of the answers, because top tip, nobody does. And I think that's okay for us. And again, we touched on it in a few minutes ago and in the Women in Tech event, that we're all learning all of the time and we might get something wrong, but let's ask the question and do it in a positive way that doesn't offend anyone. And if someone does take offence, then let's apologise for it and make sure there's clarity on the understanding, and then be educated. And don't think that you're beyond being educated on there. And equally recognising that different people will have different perspectives and different views. So we touched on social value with Joe earlier on. I meet with lots of senior stakeholders across various parts of the public sector. And I can almost guarantee that every single one of them has a different definition of what social value means to them. And if you don't have the conversation about what it means to them, then you make an assumption that it means the same thing to everybody. And that's a dangerous thing. So again, be curious. What does it mean to them? And why does it mean that to them? What makes that important and a differentiated perspective that they've got? And walk away with newfound knowledge.
Do you know what, Martin? It took me longer than it should have done to work out that most of us are really just making it to differing degrees. Okay, so we're coming towards the end of our conversation. I've got 2 more questions, and I would like each of you to maybe look to the future now and just share one thing that you're planning to do, that you've got coming up in the sphere of equity that you'd like to share with our listeners. And Annie, I know you've already talked about the Equality Impact Assessment Tool, which I'm very excited about. Is there anything else you'd like to just share with us, one thing by way of future plans?
Yeah, I think in terms of that tool, at the moment it's focused on equity and it's a really early iteration of it. We need to test the outputs of it with the people it impacts. And I think something we've said right from the start that's really important is we're not afraid to fail. We're just giving something a go here, and it might not work. And so if that isn't the right thing, then we'll be looking at what else we can do. We're going to keep going with that journey to try and make things better. If it does work and we think it's something that can really help our trust, then some of our next steps will be to scale that to other impacts. So including things like quality, environmental impacts, sustainability, finance, which actually all need to be balanced when you're making a decision about a change. So it makes a lot of sense for them all to be together. And also what we want to do alongside that is really look at how we build our process and our system and change the culture really of our organisation. What can we do? Because it's not just about a tool. It has to be about organisational change and thinking differently as well. So that will be a priority for us going forwards.
Thank you, Annie. Joe?
Thank you. Yeah. So one of the things that we're focused on, I mentioned the recruitment earlier on. I think we'd really like to get a couple of teams of wholly female engineers into the company. Conscious there's a risk that could feel like lip service again. But actually, I think, seeing a team of women developers work together would be really inspiring for a lot of other women and a lot of young women in particular in major engineering service. So that's one thing we're thinking of. Annie's mentioned the AI. You can't sit in a conference these days without mentioning it, can you? But certainly we're looking at how we can use that. We're already using that recently around things like doing the safety assessments, also the accessibility impact assessments that Annie mentioned and the quality impact assessment. So I think that's going to make a lot of difference in terms of making the equity a daily part of software development, software delivery. That's something we're really keen on, both in terms of using AI, but also in terms of ensuring that our processes with our teams, our engineering teams, are designed so that these things aren't a consideration at the end of a delivery, but you're doing the impact assessments in an ongoing manner throughout the process.
Brilliant. Thank you, Joe. Martin?
I think I've mentioned a number of things that we're doing pretty well as an organisation up until now, but I think the clear thing for me, particularly after today's announcement, is how do we bake the equity charter into the fabric of how we operate within our organisation? We've got a great opportunity to accelerate the good work that we're doing already, and really keen to explore how we make sure that we drive greater visibility, awareness of the agenda for everybody in order to make sure we get the best possible outcomes. I did say that it shouldn't be a big gesture, and it should be something that we bake in to just how we work. So I think for me it's working out how do we make sure that becomes a natural embodiment of our way of working within our organisation, and then get out there and be making sure that every single customer is considering that in exactly the same way. We've got a significant amount of employees in our organisation that engage with customers across both public and private sector every single day. So how do we make sure that message is getting out to as many as possible?
Thank you, Martin. Listen, I'd like to thank Annie, Joe and Martin for joining me on this podcast today. Really grateful for the support from Aire Logic for the Equity Charter, and really excited to be working with Virgin Media O2 Business, and also for Health Innovation Kent Surrey Sussex, my employer, for hosting the Equity Charter. If people listening would like to find out more, you can visit our website, equitycharter.digital. You can sign up to be a supporter, you can join our community of practice, and please do get in touch and share your stories with us, because it's all about the stories that we want to amplify and share and grow the impact and grow the community. Thank you very much.
Thank you for tuning in to this week's episode of the Equity Charter podcast. Don't forget to rate, review and subscribe to the series. And if you'd like to know more, go to our website at www.equitycharter.digital. You can follow our page on LinkedIn, join our community of practice, and you can also contact us at hello@equitycharter.digital.